How to apply MAG-TQ. Apply device at least 2 to 3 inches above bleeding site. Apply device skin level if possible. If not achievable, you can apply over clothing, but ensure to remove any objects from the casualty's pocket. Connect magnetic V-buckle and pull tight, ensuring as much strapping has been pulled through as possible. Twist the windlass rod until bleeding stops. Secure the windlass rod in gate. Route remaining strapping. Close with the time tab and record time applied. To remove the device, release the time tab and untwist windlass rod. Pull the tab upwards until the magnetic buckle disconnects. Dispose of as clinical waste after use. MAG-TQ, made to save lives.